Hi, thank you once again for joining me in continuing the anti-cancer treatment. So I'm going to start off with the second classification, that is drugs altering the hormonal milieu. Drugs altering the hormonal milieu. In simple words, what are the ways we are going to treat the cancer patient using the hormonal therapy? So this is what we are going to see over here. Now, hormonal therapy, or the hormones which we use in case of anti-cancer treatment, it's not going to behave as a cytotoxic drug. They are no longer going to behave as a cytotoxic drug, but they are going to modify the growth which are purely based on the hormones, especially the tumors which are hormone dependent. In those areas, these particular drugs will be bringing out a change in that. So I will just revise the classification. So the first group that we have over here is glucocorticoids. Glucocorticoids. And we have prednisolone. The second group that we have is estrogen. And we have phosphestrol and ethinyl estradiol. The third one that we have is selective estrogen receptor modulators. Otherwise it is abbreviated as SERM. We have tamoxifen and toremifene. Next we have is selective estrogen receptor down regulators. And we have fulvestrant. The next what we have is aromatase inhibitors. And we have the drugs like letrozole, anastrozole and exemestane. Next we have is anti-androgen, where we have flutamide and bicalutamide. Then we have is 5-alpha reductase inhibitor. And we have finasteride, dutasteride. Then we have gonadotropin releasing hormone analogs. And we have neferalin, triptorelin, and triptorelin. And last we have is progestins, where we have hydroxyprogesterone acetate. Now we'll start off with glucocorticoid. They have a very marked lympholytic action. As a result, it is very useful in case of acute childhood leukemias, blood leukemias, as well as in case of lymphomas. Here remissions are very rapid, but at the same time relapses occur at certain intervals, due to which the response caused by the drug is also lost. But this particular drug has been found to be very useful in case of Hodgkin's disease, as well as it plays an important secondary role in some hormone responsive breast cancers. And obviously glucocorticoids, it comes under the classification of corticosteroids apart from mineralocorticoids. So corticosteroids, they play an important role in providing relief to the complications that arises out of these anti-cancer drugs like hypercalcemia and bleeding, hemolysis that can take place due to thrombocytopenia, increased intracranial tension, and mediastinal edema, which happens due to radiotherapy. And they also provide or afford symptomatic relief by antipyretic and mood elevating action, and they also potentiate the antiemetic action which is carried out by the ondansetron and metoclopramide. And here we'll be using drugs like prednisolone or dexamethasone for its use. Now we'll see what do we mean by prednisolone. Prednisolone is 4 times more potent when compared to hydrocortisone. Though it is very potent, still it holds a high drawback, that is fluid retention happens in the body when it is given in higher doses. It has an intermediate duration of action. Intermediate duration of action. It causes less pituitary adrenal suppression when a single morning dose or alternate day treatment is given. It is also used for allergic, inflammatory, autoimmune diseases, and in malignancies. The dose administered is 5 to 60 milligrams per day oral, 10 to 40 milligrams intramuscular, intraarticular, and also topically. Prednisolone can be administered. So usually we use prednisolone, and very rarely we go for using dexamethasone. Dexamethasone is very potent, and also it is a highly selective glucocorticoid. It is long acting and it causes very less fluid retention and hypertension problems. It is used as anti-inflammatory, and in case of allergic conditions, 0.5 to 5 milligrams per day orally. Shock, cerebral edema, etc., a dose of 4 to 20 milligrams per day intravenous infusion or intramuscular injection is also given, and this particular drug can also be used topically. So this is about glucocorticoids that we will be administering to the patient. I hope you have understood with the first classification, glucocorticoids. I'll be continuing in the next class with the remaining ones. Till then, take care. Bye-bye.